Okay, so great. Hopefully you all managed to, you now know a couple more people than when you first arrived. So thanks for playing along. We might do a couple more of those throughout the session. So you to, especially those of you doing that for the first time, you've got the opportunity to work out how to do it. So hi, for those who don't know me, which is probably most people, I'm Glenn Poole. I'm CEO of the Australian Men's Health Forum. And I want to start by first acknowledging the traditional owners of the lands where we all meet today, and pay my respects to elders past, present, and emerging, and acknowledge any Aboriginal, Torres Strait Islander and First Nations people joining us today, and to acknowledge that I'm joining you from the lands of the Gureng Gureng, the Gurang, the Bunda Bunda, and Balai people here in central Queensland, between Bundaberg and Gladstone, next door to a town called 1770, and 1770 being the year that Cook first sailed around Australia, and 1770 being the second place that Cook's crew put foot on Australian soil. And so where I'm joining you from today is very strongly tied to the shared history that we have here on this land, Australia. And today is definitely the most culturally diverse day we've had in our Zoom over the last 4 weeks I was going to say 30 days, in fact, last 30 days of June. So for those who don't know, we're what's called a peak body, the Australian Men's Health Forum. So we don't deliver any services. We have members who are all in different ways working to improve the lives and the health of men and boys. And when we talk about health, we're not just talking about going to the doctors and cancer and mental health issues. We're talking about all the things that keep men healthy. So it starts with good education and our experiences of fatherhood and family life, relationships, our working lives, the environment we live in, and for those from disadvantaged communities, things like discrimination, prejudice, racism, all those things that shape our lives and impact our health, different forms of trauma from the past or present experiences, and access to good support services that really recognize what our needs are. And so when we're talking generally about men and boys, a lot of what we do is we champion projects that are really good at engaging and connecting with men, because health services and support services and the charity sector, usually it's mostly supporting women. It tends to be better at reaching women, and there aren't as many services reaching men. So that's just men and boys in general. And then when we get into all the different layers and experiences of being a man, whether that's disability or sexuality or race and ethnicity, then we tend to find that the issues that men face get starker, and the ability to get access to good services it becomes harder. So we're funded by the national government, and have been for the last 2 or 3 years. Very small organisation, but trying really hard to understand all the different health issues that impact men and boys, and to understand all the different populations and communities of men out there. So in our national men's health strategy, there are 9 priority populations, and one of those priority populations is what we call CALD, C-A-L-D, as I'm sure most of you will know, which is a group of people who just all live together in the same town or something? Of course not. It's the most complex and diverse mix of people to just, and in our men's health strategy, it just says those 4 letters, CALD, and says the CALD men are a priority, which is great to know. And then it says absolutely nothing about how CALD men, culturally and linguistically diverse men, are going to be made a priority. No one's really seems to have thought that through. So how good are we as an organization at engaging with and understanding the health needs of culturally and linguistically diverse men? Not good at all. Can we cover it all? Can we cover all the health and social needs of all the different men and boys all over the country, from all the different cultures and with all the different languages? Of course not. So should we do nothing? No, we should try and do something. And we should start a conversation. And so today for us, having spent a month talking about different aspects of men's health, physical health, mental health, suicide, fatherhood, young men, older men, men in rural communities, having spoken about all these things, we think it's really important that we at least start a conversation about how do we better understand the needs of culturally and linguistically diverse men and boys, and how can people working with culturally and linguistically diverse men and boys better understand what it is that we do and how can we be a partner. So that's me. As you look around the room, you'll know that there are a mix of people. There are men and women. There are some Aussies. I'm English. There's definitely some people born in Australia. There's a real cultural mix, I'm sure. Have we got every single culture represented? No. We probably haven't got every state and territory represented, but there's a nice mix of people to start a conversation. Everyone's welcome to speak, but I will give priority to people who identify as culturally and linguistically diverse, and those working with culturally and linguistically diverse men, first and foremost, because you're the people we most want to hear from. And then if you don't fit into those categories, you'll still get a chance, but I'm not going to come to you first. And so what I'm going to do to start off with, we'll do a couple of things today. We've said we've got till 4 o'clock, but that's probably too long on Zoom. So we'll aim to go for about 3:30, but we will keep the room open till 4 if people want to stay and talk, that's fine. We'll definitely go around the room now and start to get to know everyone who's present. And then with a room of this size, we might break you down into some small groups again to have some conversation about what are the different health issues and social issues in the communities that you represent, and then share some of those conversations so we all get to hear them. So I'll start we've got about 20 people. You might find me skipping over. Look, for those of you who don't know, at the top right-hand corner of Zoom, you have 2 choices. You can either click on speaker view, or there's like 9 boxes. If you click on that, you get a view of everyone in the room, which makes the experience a bit more inclusive if you haven't worked that out. So I can see everyone on screen. Some people haven't got their camera on. That's fine, it's your choice. We are recording, but just to look back at, we're not going to share this conversation. We're not going to publish this conversation. We're just going to keep the recording for us to look back at ourselves. So yeah, I'll go around the room. There's about 20 people. So we'll take about 15, 20 minutes, just giving everyone the chance to introduce themselves. And we can start to get a flavor of who's in this conversation. So the main things we want to hear are, where are you sitting in Australia? So where in the country is represented. What's your story? Where are you? What's your heritage? What's your culture? And then what are you? are you working in this space? So do you represent an organization, and what does that organization do? And that'll start to give us a bit more of a flavor of the type of people in this conversation. So, and I'm just going to go around my screen, people I see first, which means Mohammed Yassin. That means you get the honor and the privilege and the challenge of going first. Mohammed, over to you.
Oh, thank you very much. Thanks, everyone. Great to be here with you. So yeah, my name is Mohammed. I'm from Victoria, live in Melbourne. I am from an Iraqi background. So I came here as a refugee 19 years ago. And what else? I am a commissioner on the Victorian Multicultural Commission. I am on the board of the Ethnic Communities Council of Victoria. I also work with a migrant resource centre called Spectrum in the Melbourne's north and west. I'm very interested in the field of mental health and youth. So this is a great opportunity to hear from you all.
Great. Thanks for being here, Mohammed. Good to meet you. So I've got a Samuel to my right. Samuel, can you hear me? You just unclick your mic. There you go. That's it.
Oh yes, I'm Samuel Williams. I'm originally from West Africa, Sierra Leone. Been here for over 14 years now, and part of the South Australian Multicultural Men's Group. And we work with. It's just an independent group. We work with members from the core community, men's, and we support them in issues that are affecting, men's health, and and encourage men to come out and speak in a safe environment. And yeah, so that's the sort of thing we do. I also work for the Department of Human Services with people with mental health and disability. And I'm also a law graduate. That's it.
Great. Thanks, Samuel. And yeah, I've had some interaction with Sadiq Bar. So yeah, I think yours is one of the services that we have had some interaction.
Yes. Yeah.
Not a lot, but we've been in touch. Yeah. So yes. Good to see you.
No worries. Thanks.
William Dorr, I've got you next. I think you just need to unmute. So make sure you click on find your microphone, William. Bottom left-hand side. There it is.
Yeah, I'm William Maluk Majagdo, originally from South Sudan, arrived here in 2003. Currently, I'm working in Wyndham Community and Education Center, a special sector called Junuba Wyndham, which is a community support group for South Sudanese who are living in the Wyndham City Council, which is in Victoria, Melbourne, suburb of Werribee. And also I run a group of men group, which is mostly from South Sudan. And what we do, we want everyone to feel that you have someone to share with his concern or his happiness, that not to feel that he's isolated and no one can talk to him and all these things, because some of men in my age and even those who are older, they miss their mate and they need some people to share their concern or also to be socialized with them, and that we are trying a little bit that we can keep them healthy. Thank you.
Great. Great. Thanks for being here, William, from Victoria. And also in Victoria, I think Augustino, but Geelong, if I remember rightly. I'd like to say hello.
Good afternoon, everybody. Nice to meet you all. I'm Agostino from Geelong. I work with diversity, especially in the we call it Happy Living Center, especially for the aged care group. And also, I'm the community as a community leader in Geelong, and also as well as in the Victoria. So I'm used to work with the city council and also VMC, like to connect our community with the greater city Geelong. So I'm used to participate in the parent information session, especially in the main group. We call the father that group. So we have information session for for the healthy living, and also information about how to live in the Austria, how to keep contact and relationship with the community, local community, other local community, and especially in for the main. Our main, so we connect with the job to get a job. Like I said, we have a contact with the local business people. So most of our people like to work. So now they are most of our the men they got a job. They got a job already, especially in the farming and also meat factory and also the chicken farm. So many people lost their during the time. Many people lost the job, but our community still working hard. So they are happy because of that they didn't lost their job. So they didn't lose their jobs. So that is my responsibility, especially to as a community leader. I can contact with the other community and the local community, like the civic community. Thank you. Thank you.
Thank you, Augustino. Thanks for being here. So we're going to cross the sea now, and we're going to head way over to Tasmania. And I think one of the other groups we have had contact with over the years is the Migrant Resource Centre. Are you the Hobart, Jal, or?
Yes, I am. But we're also in Launceston. So before I start, my name is Jal David, and I also want to acknowledge the Tasmanian Aboriginal community and acknowledge that the rightful owners of this land that I work on.
Just frozen there, Jal. Okay, Jal, we might come back to you. You've just frozen. I know it's cold in Tassie, but I think it's more of a technical thing. So Anoop, I'm going to come to you. We'll come back to Jal. You just need to unmute, Anoop. That's it.
Yep. Hi, everybody. So my name's Anoop. So I work for Mental Health Australia. I live in Canberra. Yep. So to give you a bit of background about myself, I'm originally Indian, but I'm an Australian citizen. But I embrace my culture very much. Anoop means unique in my language. So there you go. You guys have all learned something new. The next time you want to say something, you've learned something new or unique, just say Anoop. Makes it easy. Anyways, so I'm working on a project called Embrace Multicultural Mental Health. So which is basically us trying to bridge the gap between services and multicultural, or called consumers and carers. So we're trying to bridge that gap by getting primary healthcare networks to work with their commission services and work with other mental health organizations and multicultural organizations, just to understand how everybody should be moving forward together, rather than having that differentiation of this is not our responsibility, and you're having a lot of services, a lot of individuals have approached services falling through the gaps. Before I moved to Canberra, I was in Melbourne. So I was working with Waterville Project as a volunteer, where we were doing a lot of events with the men's and boys groups, where we would be speaking especially on reproductive health, oral health. Oral health is something which is very important for me because I'm a dentist by background. And we were also talking about cardiovascular health and other important things that men usually tend to neglect, where they feel that as far as we're breathing, it should be perfectly fine. I don't have any symptoms just showing up. So we're just definitely going to neglect it. So those kind of things. So starting up that conversation, and even in terms of resources, when we usually focus on giving resources when we see a particular cultural group, we don't realize whether that might not be the language that they read and write. They might be speaking the language without, might not necessarily be reading and writing it. So bringing out those audiobooks, and we always miss out on the disability sector as well, where we don't see whether we're giving that support for the disability sector. So trying to see whether we can get resources in sign language. So a lot of things where, you know, so some of it is in my personal capacity, which I do outside of my work. And so in my personal capacity, I do a lot of radio work as well, trying to educate people or improve that health attitude through the radio in different languages, because I speak a few different languages and I use a lot of interpreters as well. So that's pretty much everything that I do in a nutshell. Thank you.
Thank you. Thank you for your unique introduction, Anoop. Your appropriately unique introduction. Next on my screen, I'll see Jal's come back. We'll come to you in a moment, Jal. Good to see you're back. You're back in. Excellent. Marianne, just going to come to you next. Marianne Geronimo. You need to unmute first.
Yeah, is it me?
Yeah, got you.
Hi, I am Marianne Geronimo. I'm the Director for Policy on Health and Aging at the Federation of Ethnic Communities Council of Australia. So FECA is a peak body for ethnic community organization or multicultural communities organization. So organizations like Diversitat or the Sunray Jamali, I think I've seen Dean somewhere here, are members of FECA. So FECA has state level members that help us, our work is not so much into service delivery, but we do policy advocacy most of the time. And my particular portfolio, as you know, obviously is on health and aging. I'm Filipino, that's my background, but I'm a recent migrant here in Australia. I'm just on my second year, but I used to live in Singapore for about 12, 13 years. And my background really is on research and policy. And my current and recent work has always been about understanding how health policies are affecting migrant communities. I have done previously research on self-care, primary healthcare, chronic disease management, not for men in particular, but I have done randomized controlled trials where particular interventions were segregated for men and women. Currently we are working hard in the aged care space, especially for FECA. We know there are specific challenges for people of called backgrounds in aged care. And we see quite a fair bit of knowledge on how men as well are experiencing aging, although we know that women have a very unique experience of aging itself. So one of the key things that we have been learning so much about men is on the mental health space. I think FECA has been working very closely with Embrace in that area, and we are looking forward to contributing more in this platform.
Right, wonderful to have you here, both individually, Marianne, but also great to have FECA connected into this conversation. Thank you for being here. Jal, I'm going to jump back to you while we've got you. And if you struggle, one of the things you can do is knock your camera off. You sometimes get a clearer bandwidth, but have a go again.
Sure. So I'm Jal David, and I'm with the Multicultural Youth Tasmania at MRC, the Migrant Resource Centre. Mm-hmm. We work with young people from age 12 to 25, but one of the programs that I run is work predominantly with young men that are either at risk of disengaging or disengaged from the area of community, education, and employment. So we try to help them in those key areas, and those areas can be stretched out, obviously. So one of the examples, for instance, the community is like legal support. So I provide a lot of legal support, from going with them to court, to sitting with them, to providing support letters and things like that. And we also have a similar program in the north, in Launceston, that we just started at the beginning of the year. Culturally, I think I am Tasmanian and also Australian, but I know that those two words are more synonymous. They're more synonymous with being white. But I think I am that because I've been here for a large part of my life. I came to Australia 17 years ago when I was 15 years old. So I am originally from South Sudan, but I grew up in Kenya. Yeah, but I'm South Sudanese, also Tasmanian, from Labins Bay, and Australian at the same time. Thank you.
Right. Thank you for bringing those multiple identities to the conversation, Jal. Really appreciate it. Polly, I'll come back to you. Polly. Just unmute yourself, Polly, please.
Yeah, that's all right. Yeah, my name is Polly Kiaga. I work in the same team with William Doe. We are working in a program called a community support group program, which is working with young people of South Sudan's background and their families. But as you know, we cannot work in isolation. So we also do work with the families. And that's where William is running a men's group, whereby men come together once a week, sit down and have a conversation about multiple issues coming to young people driving without driving without driver's licenses, or young people just coming out of the youth justice system. How can they be supported? But also to support their family members who are supporting those young people who are just coming out of the incarceration. I'm a South Sudanese, was born in Uganda, grew up in Uganda, and was educated in Uganda. I'm living here in Melbourne, Victoria, in particular, specifically in Werribee. Yeah.
Right. Thanks for being here, Polly. Really appreciate your contribution.
Thank you.
So coming to you, Dean, are you able to unmute yourself there?
Hi, Dean Wickham from Mildura, Northwest Victoria. I'm the Executive Officer of Sunraysia Mallee Ethnic Communities Council. So our little town out in the bush and the semi-arid desert, which is, I guess, as close as you can get to outback for Victoria. We currently have a community that's growing. Right now, we're somewhere around 76 CALD communities in Mildura local LGA. We also take in Robinvale, which has another 74, and Swan Hill. We cover 4 LGAs. We're funded by the federal government and also state government. We're part of Ethnic Communities Council Victoria and Federation of Ethnic Communities Council. I've worked alongside Polly in the past when we've done some work with AIMS. We have a bunch of community-based programs. The one that we're really proud of is our little play group. We also have some what we call family strengthening program, which is actually family violence funding, but we like to reframe it to look at the strengths approach. And just recently we've added a father's play group into the mix to try and look at some gender equity and bring a different mix into the local scene. It's a little tough, but we're getting there. And then with COVID on top, we've had to kind of down tools for a little while. Hence, that's why I'm on this link up to see if I can listen and learn to some of the people doing some fantastic work already in the sector. So thank you very much for having us on board.
Great. No, thanks for being here.
Sorry, I'm from Solomon Island background originally. I've been here in Australia since I was 11 years old. So I'm a Pacific Islander and would fit right in, I think, in Queensland. I'd love to live in Queensland, just saying. But it's bloody cold down in Victoria. Thank you very much.
Yeah, and that's a beautiful link to our next speaker, who up in Brisbane is Francis.
Hi, good afternoon, everyone. Yes, this is Francis. I call Brisbane home. Until recently, I was teaching English as a second language to international students and new migrants to Brisbane until international borders closed. And so now I'm unemployed. So thank you, COVID. I'm an aspiring men's health and mental health advocate. I'm currently working towards a master's degree in social work with a specialization in mental health at the University of Queensland. My background, I was born and raised in Singapore. Anyone else here who has a Singapore connection or heritage? I feel you. And before I came to Australia as an international student many years ago, before becoming an Australian. Culturally, it's a very tricky question for Singaporeans because we are very staunchly and proudly a multicultural and multiracial and multilingual nation. So our culture is not tied to our visual appearance. So I feel a little bit Chinese, a little bit Malay, a little bit Arab, a little bit Indian, a little bit European. But our longest history has been a colony of the Brits since 1819. And that's what colonization does to you. You know, you're left being very confused about who the bloody hell you are. Yeah, and I guess for this conversation this afternoon, I'm also interested to unpack what do we mean by the term culturally and linguistically diverse in Australia? Which groups are we thinking about? When you use that term, are you thinking about someone who looks like me, or Giles, or Mary, or Polly, or could it be someone who looks like Amanda, or Glenn, or Scott? Yeah, so thank you, everyone.
Great, thanks, Francis. Aspiring men's health advocate, confused of Brisbane, bringing layered and complex questions to the conversation. Thank you, Francis. So we've got Kudzai next.
Hello, my name is Kudzai Nyamande. I'm from South Australia, Adelaide. I'm in the same organization with Samuel, which is the South Australian Men's Group, which is a new organization which has been formed with the idea of helping men from multicultural backgrounds who have got a history of a lot of stigma with mental illness and social isolation. So we are trying to provide a safe space for men to come and ventilate and also network with each other. I also work in another organization called No Kutenda Disability Foundation, which is a registered charity which works exclusively with people from African and colored backgrounds with mental illness. We run a web chat service, which is an online platform as well, where people from African and colored background can go there, talk to a mental health professional and get help. It works like a crisis line. So we've been working since 2017. So I think, I'm a mental health registered nurse. I've worked in mental health for close to 20 years. So I'm quite passionate about mental health. I've worked in the United Kingdom and then moved to Australia in 2012. So I've been in Australia since 2012. I'm originally from Zimbabwe in Africa. So that's where I was born. But I left Zimbabwe when I was around 19, 20, spent quite a few years in England before coming here. I'm also working in the space for mental, I'm doing a PhD in mental health, and I'm looking at the understanding stigma in African and indigenous population with mental illness. So I'm in my first year, and the main thrust of my study is looking at why there's a low utilization of mental health services in this target population. Because I think, as some of you know, that the African population is one of the highest now. It's second highest to the indigenous in suicide rates. You know, it hasn't been publicized, but it's the second highest to the to indigenous. And there is a lot of reasons why that rate is that high. You know, with the issues of stigma. So I'm looking at how we can bridge that with those two populations so that we can arrest the kind of the increasing rate of suicide in this target population. Thank you.
Yeah, thank you, Kudzai. Thanks for all you're bringing to this conversation. So now we've got Gabby. Gabby.
Hi everyone, my name's Gabby Martinez. I work with the Southwestern Sydney Local Health District in Southwestern Sydney. One of the areas we cover is Fairfield, where it's got 45% of the refugee intake from New South Wales. I actually live in Wollongong though, so I commute up there. We're running a program at the moment called Tackling the Challenge, which is basically a narrative project. So what we're doing is we're interviewing men about their experiences of overcoming a challenge in their life, just to break down some of that stigma and work out what, you know, showcase their resilience and what, if any, help seeking they sought. And we're publishing that in different ethnic newspapers. And well, it started off as a project with the Anglo community down in a rural community, and now we're expanding that right across all our 6 local government areas. So, but I'm interested in all your conversations, and particularly about identity. I thought that was really interesting because I myself was born in Uruguay, but I say I'm Australian, and it took me a long time to say that. But so that was something I struggled with all of my youth.
Great, thanks. Thanks for the thanks both the professional and the personal there, Gabby. Really appreciate it. And I've heard a lot about the that narrative work you've been doing in Southwest Sydney. Great to hear it's extending into different cultural communities. That's a great piece of work. So looking around, Scott Brown, haven't we heard from you yet?
Hi everyone. I'm a community development and youth worker for Seneca Multicultural Services in Cairns, Queensland, North Queensland. We look after refugee migrant settlement in Cairns and in the region. I'm pretty much the guy on the ground. I get to do all the fun stuff. I get to do the men's group. I get to work with kids all the way from prep all the way up to year 12 and beyond. So I get to do lots of great programs. We've got a lot of Congolese as one of our main cohorts. We've got Bhutanese, Burmese, Arakanese. We've got a very big range of clients, and they're all wonderful people to work with, which makes my job really fun. And yeah, lots of different languages. In one class or program, we can have 4 or 5 different languages with all our bicultural workers were once clients, and now, you know, they're bicultural workers, translators for us, and they're the best people for the job. And without them, we couldn't do our job basically. So we're really lucky in that sense. So I've made some really good friends, and I'm fairly new to the industry, but I'm loving it. And basically I try to create a space for kids or the parents where they can feel comfortable. I try to make them feel more like a friend than a client, and I find that's where they can open up to me or come to me to talk about something that they, you know, that they need to. And I just try to help them with anything they need. Like we do, you know, small programs on road rules, or practice learners, driver's tests. We touch on mental health a little bit. Sometimes we'll just go and have a barbecue and play soccer at the park. There's lots of just basically trying to fit our communities, our clients into the community. And yeah, it's an awesome job.
Right. Oh, thanks for being here, Scott. Good to get a fellow Queenslander in the house. You're officially the furthest north so far.
Yeah.
So I can see we haven't spoken to Jed or to Pahal yet, but your cameras are off. But Jed or Pahal, and also Samuel, your camera's off. I think we've spoken to Samuel. I'm trying to recognise you visually. Mohammed, and Mohammed we've got. Pahal or Jed? Jed, your camera's on. Jed. And then I'll come to Pahal next.
Hi everyone. Thanks, Glenn. I've been following the forum and I've been enjoying it since the start, but I've just been on and off and just trying to balance. Currently working at home. So I'm Jed. I'm from Western Sydney University, so from the School of Nursing, and primarily I lecture in nursing and do some research. So in terms of culturally and linguistically diverse population, it has been the center of my research ever since I started a research career. So I look at colored populations. Primarily, I'm Filipino by ethnicity and immigrated to New Zealand in my younger days and then finally here in Australia. So it's been that cross-cultural kind of shifts, and also, I totally relate that aspect of trying to identify yourself and so actually, who are you in terms of what you identify? Because in terms of my experience with research, it's very problematic when we look at ethnicity alone. So when we use ethnicity data and research, it's not the easiest demographic profile, because people can have 2, 3, 4, 5 ethnicities. So it's really tough when you look at that kind of data in the demographics. But then, indicator in a lot of things, indicator in terms of health, indicators of perspective to whatever, to a lot of things. So it's really important. So yeah, so just me.
Right, thanks for being here, Jed. Pahal? And you saw your face pop up a second ago. And Isaac, I'll also come to if Pahal's not there.
Yeah, no, I'm here.
Awesome. Hey, Pahal.
Yeah, how are you?
Very good. Love to hear from you.
Yeah, just I'm here on the camera now. Anyway, just I'm on the car, just I parked, pull over the car. Just originally, I was from the Bhutan and I'm living in the Victoria, southeast of the Victoria. That's called Wodonga.
Yeah.
Yeah, I'm working in Wodonga Ethnic Community Council as a board of director for advocating for the people, migrant community. Yeah, what come with many of the challenges to where I'm working and helping to the communities. Every time people are advocating for the women health or the focusing more to the women, but neglecting to the men. But the men are also having the problem. But if everyone is would have a thought or have a bit of time for thinking about the men, that could help not to have the too much stress, like particularly in the migrant community, like the men have got the different status before coming to the Australia, and when the people are coming to the Australia, then they have got different environment and different situation, and the people the men can't open like how the women are opening too much. Yeah, that's the reason why the men are having the too much problem and fear bit of the suicide in the migrant community. That is what I can recommend to start thinking.
Yes. Well, thanks for being here, Pahal. And stay safe in that car. No driving and Zoom together.
No, I'm not driving anyway.
Good. So, Isaac, are you there? Also have
Hello,
some...
yeah.
Hey, great.
Yeah. Sorry, I just joined. I was a bit busy. So my name is Isaac, and I work for Relationship Australia in Adelaide. And my work is more in a program called Peace. And in Peace, usually what we do, we work with clients who are at risk or affected with HIV, hepatitis, and also gambling. So usually we do community education and also case management, counseling, mental health, and so on, drugs and alcohol things. And yeah, this is basically what we do. And also I'm involved in the men's group that we just established in Adelaide. I saw Samuel and Kuza, who spoke earlier. We belong to the same men's group to see how we can create a free and safe space for the called men to come together and discuss and talk about our own issues and problems.
Yes.
Yeah.
That's wonderful, Isaac, and thanks thanks for being here.
Thank you.
So there's one person in on the phone. If you know who you are and you're able to unmute yourself, please do and shout out your name. And just as I said, that person dropped off. Okay, so looking around the room, Corey, I think we heard from your colleague Dean, but we haven't heard from you.
Yeah, hi guys. Yeah, Dino had to jump out and rush off, so I'm subbed in his place. Just quickly, so I work with Dean at SMEC, Asian Malay Ethnic Communities Council up in Mildura. Yeah, I'm running a program, a try, test and learn program, which is sort of working with, we're settling migrant families out of Melbourne CBD to rural Victoria, so Loddon Mallee region. Obviously right now things are marginally challenging with moving people out of the city, as you'd imagine, particularly Melbourne, but the program has been going along quite well. We're starting to see families with sort of teenage boys and a bit older, so that's a big, this forum is an interesting opportunity for me to listen and learn, I guess. I'm fairly new to this sector, coming out of a finance background actually, so I gave up the money for the love, basically.
Excellent. As long as you've still got the love.
Got the love, mate, yeah.
Yeah. Because as the Beatles famously said, money can't buy you love, and love can't buy. There
And
you
all
go.
you
Anyway,
need is love, right?
all you need is love. And, yes.
She loves
all those
you.
things.
We could go on.
It's in a song. It's in a song. It must be true. So
exactly.
Kim and Shrufi are on staff. Said hello to most of the guests that we've not met before. And we've got some Men's Health Connected regulars I want to quickly say hello to too. So Gerard.
I'm from Ballarat. I'm actually currently a student at my age and certainly interested in men's health. I predominantly have an English history, although I do have an Aboriginal history. My great-great-grandfather was Aboriginal, so that's very exciting news. We found out that only sort of in the last 10 years, so that's an avenue I wouldn't mind actually getting involved with Aboriginal men's health. Maybe. I'm just not sure. I'm due to graduate end of this year. So it's sort of been a great learning experience coming onto these forums and meeting so many people. Wonderful. Thank you.
Right. Yeah, good to see you again, Gerard. And another regular, both as an individual and the organisation, Amanda from Top Blokes.
Hello, thank you. So personally, I'm first generation Australian. Parents are both Sri Lankan. And then, you know, a couple of generations back, we're Scottish and German and Dutch and English. I grew up in a very Anglo-Saxon area. I was the, and you'll laugh at this, the black kid at school. So that was an interesting challenge. I have a background in welfare work, so working with young people who are homeless or at risk. A part of what I did with that, there was actually, we got some funding to do a research project through SydWest International around multicultural and cold access to private rental in a small pocket of the Western Sydney area, and it was very eye-opening. But we were able to connect some real estate agents with some migrant support centres and that sort of thing to help smooth over some of the tenancy issues they were having, rather than it getting to a point where they were getting, you know, evicted and then having permanent marks on their record. currently working with Blokes Foundation, and I've been Men's Health Connect junkie over the last month, trying to get to as many of these forums and meetings as possible, because it's just been absolutely phenomenal for networking. Thanks, Greg. And meeting other services we can work with. So Top Blokes, we do social education and mentoring for young men, sort of 10 to 24 in schools, in primary schools, high schools and community groups. Based in Western Sydney, we're seeing an increase in culturally diverse participants. So just here to learn, really. Love this space, know that we've got a lot of work to do, but want to see how personally and organisationally Top Blokes and myself can participate.
Great. Wonderful to have you here again with the many different experiences you bring to the table each time you come. Always good value, Amanda. So thanks for being here. And we've been all around the room, but Greg, I saw you've popped in as well. So do you want to say a quick hi, Greg?
Yeah, hi. Sorry I'm late, guys. I'm the president of the Australian Men's Health Forum. Welcome. Welcome especially because this is a special time for me, and it may be for Glenn, because this is our last session of Men's Health Connected for the month. So to take a big breath, it's a special moment for us. But it's also a really important moment for us, for the Australian Men's Health Forum. And it's really important that we do a lot more work in this area. And that's why we want to have this round table today. And we want to gain from you and learn from you what we should be doing to better engage with people from different cultural backgrounds. That's the purpose of this round table today. So I'm waiting with bated breath to hear what we can do to improve the health and well-being of people from culturally and linguistically different backgrounds. Thanks.
Thanks, Greg. So I'm going to quickly summarize, and if I leave out anyone, I apologize. I'm doing my best. So we've got ACT Tasmania, Victoria, South Australia, Queensland, New South Wales in the room. No WA or Northern Territory. 6 out of 8 is pretty good. I'm not going to try continents, but we've definitely got, I've heard Iraq, Sierra Leone, Sudan, Myanmar, Singapore, Philippines, India, Solomon Islands, Zimbabwe, Uruguay, Sri Lanka. I've even heard England and Scotland. So it's really quite global, this room. And I've heard, mental health. I've heard suicide. I've heard about physical health. I've heard men's groups. I've heard fathers groups. I've heard social isolation. I've heard housing and tenancy issues. I've heard work, employment. I've heard the criminal justice system, youth, alcohol, HIV, and these are all health issues. So how can we cover all that in this short period of time? We can't. We can only start a conversation. A part of what stops us having this conversation is we go, well, if we put on a session or a conference, would we have enough people? Would there be enough issues? Well, from these 20 plus people already, from you good people, there is a conference here already. There's a conference, not just a session. So you've already opened our eyes to the possibility of many different conversations and connections that we could create. And we're having this conversation today. So what I'm going to do is I'm going to, because it is about health, but remember, when we talk about health, we're not just talking about doctors, we're talking about all the things that you've spoken about already. If racism is the pressing issue for you, that's the health issue. If social isolation is the pressing issue for you, that's the health issue. If it's housing, employment, that's the health issue. So I'm going to ask that we'll put you into some smaller groups and get a bit more time you've done a lot of listening. We've all listened to each other. So I want to give the opportunity to speak again as well. So I'll break you into some smaller groups for the next 10 to 15 minutes. And to make it simple, I'll just ask you, And I appreciate that. I'm going to say, you know, your community, and some of you are representing multiple communities. I recognize that. But just bring one, if you could bring one thing to the table today, what would it be? So, you know, if there's one, you know, health issue for your community or one of your communities that you could really, you know, you're really concerned about, or you really want to address, or you are addressing, you know, you're doing good work and you want to actually, you know, highlight that, then bring that to the conversation. So I'll give you a room of maybe 4 people. Each have a couple of minutes to sort of say, well, what's that one issue that you're really struggling with or doing a good job with for your community? Each have a go. And then we'll come back and we'll share some of that. So maybe one person from each group will share one of those, and we'll capture some of that. And then finally, we'll have a conversation about, well, what do we do next? What do we do? You know, next month, this year? What do we do to actually find ways to connect that enable us to address these issues more effectively and learn from each other and support each other? But so I'm going to drop you now into breakout room. So that's the exercise. Just one thing. What's that one issue that you'd most like to talk about, see addressed, or actually celebrate the fact that you're doing a good job addressing it? And I'll give you a warning before we bring you out. Just give me a second. I just need to reset these rooms. It will take me about 10 seconds, and then I will send you an invite to join a room, and I'm going to do that now. So create rooms. We've got rooms of 5. Okay. Give you 10, 15 minutes, and I'll give you a notification before we bring you out. Make sure everyone gets a go. It's the important thing. Make sure you all get to have a go. So Francis, Gabby, Giles, Jess. Okay. Kudzai. And Pahal, are you able to join the room? You may be driving. We've got 4 people in there. We've only got 2 people in there. So, and Greg's in there. So, okay.
Are you there?
Yeah, I am. Just a second. I'm just moving people around a little bit. Who did I just move? Gerard moved to 4. No, not to 4, to 5. Moved to 5. I like that whisper. Sorry, Gerard, you're going to get moved again. Moved to 5. Okay, and then where did I put? Amanda, there's a 5 in there. Amanda, you're getting moved again. Moved to 5. That's it. I'm there. Are you?
I'm here. I'm having a cup of tea.
I'm having a hedgehog slice.
Last one.
It is.
Oh, someone's come back.
Are they coming in? Oh, it's Phil Martin is coming in. All right. I've got a message from him. Got a message from him yesterday saying he was coming. He's got the timing wrong.
There you go.
Hey, Phil. Still connecting to audio. Can't hear us. It's a man who's got a lot of files. Or he's got a virtual background and chosen files. Can't hear you yet, Phil. You're still connecting to audio. You'll have to do sign language. If you can hear me, We've just got people in breakout rooms. This is the this is us on our break while other people are in breakout rooms, still connecting to audio. So you're just going to see me eating my cake. That's the best I've got for you, I'm afraid. All the action's happening in the breakout rooms, but until you can connect to audio... Oh, we're in. Hey, Phil. Now you need to unmute yourself.
Yep.
We're in. So where have you joined us from today, Phil?
Where? Uniting Communities. I'm actually working from home at the moment. I work at Uniting Communities, so I work in a family relationship team there. I've been there about 12 years. I work in the Specialised Family Violence Service. I'm also working with ARA, doing some work with community educators around domestic violence, and supporting some training that ARA's doing towards, I guess, knowledge of domestic violence, and then to be supporting those community educators to be taking that back to their communities with various projects. Like each one is going to develop a project for their community around domestic violence awareness. So it's kind of mental health as well as you know, overall healthy relationships, healthy families, resilient families, communities, which yeah, are all sort of interconnected, I think. I'm sorry I was late, by the way. I apologise to the other people on the in the forum.
That's okay. And whereabouts in the country are you?
Oh, sorry, in Adelaide. Yeah.
You're in Adelaide. Cool. All right. So we've got people in breakout rooms, and the exercise is quite simple. They're just each sharing one health or social issue that's the most pressing concern to the community or communities that they work with or represent. So I'm going to drop you into a conversation.
Okay.
Let's see which one we drop you into. Pop you into breakout room 3.
Yep.
So you get an invite, and not move. Hang on, not you. Careful. Last time I tried this, I ended up closing all the rooms. I'm going to make sure I don't do that.
Right.
Breakout room 3. Oh, you've moved to San Francisco now.
Yes. Yeah, over my background actually.
Yeah. So you should have just got an invite. If you accept that, you'll disappear into a room. Are you there, Kim?
Yes.
Hello.
Hello.
So couple of things. We got close to, not quite, but close to $2,000 of donations yesterday.
Wow.
But mainly because of 2 donations, one for 600 and one for 1,000.
Who from?
Anthony Brown gave us 1,000.
Wow.
Yeah. Interesting. If you don't ask, if we hadn't have asked, we wouldn't have got that. So yeah, I think we got about 6 or 7 donations, and they all added up to about maybe 1,800. And then the other thing is just put out invitations to join, and we've had four new. So we think we'd got to 30 organisational members.
Yeah.
We've just had 4 more. Now we've got to get those 30 to renew.
Yeah.
But I've also put out a request for people to join for the first time as organisational.
Yeah.
And we've got 4. So we've got the Man Walk.
Yeah.
Gotcha for Life.
Yeah.
Is nice. So Gus Wall and the mob.
Yeah.
The Modern Bloke has just come back and said yes. And Prick and a Pint.
Wow. Go Dr. McGowan.
Yeah, our new best friend. And a couple of other are considering, and then I'm waiting for others to get back. So that's 4 new. I sent those out this morning. I invite to about 30 people.
That's fantastic.
Yeah, and I've had 4. Just checking. 1, 2. Yeah, I've had 4 yeses. I've had 1, 2, 3, 4, 5. So I had 7 responses. So we had 4 yeses. No, 6 responses. 4 yeses. 2. 7. Yeah. So Callum, also Youngblood is open to it. So yeah. Well, I really want to get to 40, which kind of doubles our numbers from 2017. I think we might lose a couple who, were odd members anyway, weren't really kind of our typical type of member.
Yeah.
So I think we'll drop down a little bit below 30. But yeah, I feel like 40 feels like a possibility.
Fantastic.
Really nice. Yeah. Yeah. Awesome. So a bit of money and a couple of new members.
Excellent. I wonder if the president's finding out what to do.
Yeah.
So this is a good format, putting them in breakout rooms and coming back to get, I think, asking a question and coming back. It's a quick way to get to some insights.
Yeah. And also makes the participation interesting because you've had the opportunity to talk about what it is that you're concerned about. So you feel.
And it gives the discussion some shape rather than just sort of talking.
Yeah. Yeah. It's easy to manage as well because you get a bit of a break.
You can go have hedgehogs.
Hedgehogs and a cup of tea. I'll give him a couple more. I'm going to give him a 2-minute warning. Yeah, no, it seemed to work well yesterday.
Yeah.
I'm trying to work out because I've just been starting to map out, whether we continue to have these types of meetings all year round, and then just work out in my head, what the kind of what format would keep making it worthwhile. It's like from yesterday, you could see there was a potential piece of work there developing a piece on language about talking about LGBTI men's health. There's a piece of work there.
Yeah.
Which in itself would be, valuable and something that you could do on a collaborative basis. So, yeah. Anyway.
Yeah, there were so many definitions.
No, exactly. But that's then our job is not to say this is the correct way, is to actually capture those and say, this is. And it's so much nicer to actually. What I enjoyed about yesterday was and I guess because it was mostly workers, even though they all had personal experience, it was mostly professionals and workers, not just sort of activists. Because often, that space, particularly today, has a reputation for being really kind of like sensitive and confrontational and really intolerant of people getting language wrong and easily triggered and all the rest of it. And then, and most of the public debates become stupid debates around trans issues. And not that the trans issue is stupid, but the actual debate just becomes this kind of very simplistic kind of opinion discussion rather than, anything that's got any worth to it. Was that it was just people having conversation in a very kind of inclusive and tolerant way and learning through that process and actually just making the conversation much more comfortable by having it.
Yeah.
Power of conversation, the power of actually just being in genuine, authentic conversation with people rather than being in argument or kind of opinion with people.
I think it would be great to have sessions which just focused on a case study,
right?
And then a Q&A after, and
yeah,
this is a problem, and this is how XYZ is tackling it.
Yeah, community of practice type thing.
Yeah.
Yeah, so yeah, and that's what I'm thinking. Is like, but then you get the group to sort of like say what's valuable anyway, you know. But yeah, a bit of networking, but it only has to be that sort of like, you know, like 5 minutes at the beginning, so you make sure everyone has the opportunity to at least talk to someone and isn't just sort of a passive participant. And then yeah, each time have a case study, and then a bit, you know, hopefully maybe a bit where we're exchanging information about what we're doing that's relevant. You know, it's all, my brain's already going ping, ping, ping. You know, oh, we're doing this.
There are a few people in here today who have said, "I'm here to learn."
Yeah.
And Amanda from, you know, making connections.
Yes.
They've been very, very active in this.
They've been brilliant. Yeah, they're one of the groups that I've said, "Come on, it's time you joined, isn't it? Come on, you like us."
Are they joined?
Sorry?
They joined. They haven't
Not
joined.
yet. Not yet. But I'm hopeful. They've kind of avoided it in the past. I think they've just been a bit concerned about being labelled political in any way. But I think we're beginning to be seen as less political and more like you know, just a community that's it's okay to be part of. Right, closing rooms. Oh, I meant to take it. Oh, I've got this still there. Yes. So Francis, need to pick spokespeople. Welcome back. Your microphones will be off. When you come back in the room, it's automatically muted. So just be aware of that, because I'm going to come to you and ask you to speak in a moment. So just be aware you'll need to unmute yourself. Hopefully I didn't pull you out of the room in the middle of a sentence that was the most brilliant thing you've ever said, which is often the way, just as you're getting to that brilliant point. So I'm going to ask one person from each group just to give a bit of a flavour of what was going on in your conversation, just to give us a sense of the different types of issues that are coming up. So I'm going to just look at each room and pick someone, if that's okay. And Jal in Breakout 1, would you take on giving us a snapshot?
I was hoping you come to me. Yeah. There's two topics that were raised by Gabby and my group, and there are two things that are important to me, not only as a worker but also in my own journey as a black man in this culture and that kind of stuff, and also in my family and that kind of stuff. So two things that were brought up is the lack of recognition of qualifications of called men. So the kind of lived experiences that they bring over there, or the qualifications they bring from there. You know, one of the examples Francis gave, I hope you don't mind me sharing, is that he came here as a school teacher, and he had to go through more training to be able to stand in the classroom, and his frame of reference has to be Australian context, in a sense, despite the fact the kind of lived experience and also the cultural wealth he would bring and all the other qualifications he might have where he came from, were not deemed enough in the sense. And we were talking about how those things go on to impact you in with your mental health, your sense of identity, your sense of well-being, your self-worth, and all those kind of things.
Yeah.
The other thing that was brought up is that when will I be an Australian? You know, in the sense that you might have your Australian passport, you might have your driver's license, you have a good job, you pay your taxes, you're a law-abiding citizen. But in your public life, you're not. That's that still underlying question. But where are you really from? So you, in a sense, those things they do connect again. And what Francis beautifully put it is that there's a sense of a cultural displacement that you get. And William was just saying, you know, I came here fully wanting to be a part of this culture in a sense, but every day I'm reminded that I am not. I am not that when I'm in public, and so they asked when will those qualifications will be recognized, and when will one become Australian?
Yeah. Very powerful. Very powerful. Thank you. Yeah, from where I see the world, my engagement with culturally and linguistically diverse men is often in Ubers. You know, when I'm in a small Australian regional town of 2,000 people. The nature of my job is that before COVID, once every 4 or 5 weeks, I fly into a capital city and I go to a hotel, a conference, whatever. And then I get an Uber from the airport to the hotel, and that's where I meet culturally and linguistically diverse men. And I meet doctors, and I meet engineers, and I meet, you know, IT consultants who and men who've given up on that career because they've gone, it's too hard, it's too much. I don't want to do it all again. I did it once. I'm just going to carry on driving and then, you know, do the best I can for my children, make sure they get an education. And, you know, but I'm just not, I haven't got the energy to go and do all of that again. And yeah, that's a very common story that I hear just in my little focus group of Uber drivers from culture and linguistic diverse background. And you really hit my heart when you said, you know, I came here, William's story, I came here to be part of the culture, and I'm reminded every day when I walk around that I'm not yet, still not there. That just really, that hit there. So thank you for sharing that, and I am sorry to hear that's your experience, but thank you for bringing that to the conversation. And these are health issues. These are health issues, yeah. So, and by the way, Amanda's just, Amanda just popping stuff in the chat box there. You can, if you haven't discovered that, the bottom of the Zoom box is a little chat box, and you can drop in comments there. We'll capture all of that. So if you feel there's stuff to add, then drop it in there. If you want to share contact details as well, drop them in the chat box. Mr. Unique Anup, would you take on sharing about being the spokesperson for your room? I know you're shy and retiring, but if you could,
sure, thank you.
Find a little confidence, I'm sure you could take it on.
Cool, thank you. So we had Mary, Isaac, and Corey in our group. So we discussed about a few different things. So health literacy was one of the things that was brought up by Mary. So she did mention that health literacy is something which is always a little deficient, and we don't exactly do justice to the fact that in order to make everybody on the same page, and in order to make sure that call consumers have the right understanding and they know what's exactly out there, they need to have the understanding so that they can reach services and all those kind of things. So that was one of the points that was raised by Mary. And if I have missed out anything, Mary, please do raise your hands. I'm happy to correct myself. Corey had raised a point about how, since in his new role, how relocation and everything is something that he has been doing as a part of his role, relocating the newly arrived migrants to different places and stuff. And it's often difficult to put them in a community together. Sometimes it's so difficult, and they are spread apart to an extent where they might face things like social isolation, and it might affect their mental health and everything when they don't have a good support system around. So that was one of the points raised. Isaac had also, since he's working for the HIV and hepatitis sphere in particular, I'm just trying to recollect what was the point raised by Isaac. I'm trying to look at Isaac. Is Isaac in the room? Mary, do you know what Isaac had raised?
Stigmatism about the HIV you spoke about.
Isaac, sorry.
The stigma, yeah.
Yeah, stigma. Cool. Sorry, he was talking about the stigma about hepatitis and HIV. And the last point that we had discussed was about how the custodial setting. So we have a lot of prisons, or a lot of prisons in Australia. We don't exactly work in an extent where we don't ensure that in a through care sort of a process, how are we ensuring that men or young kids or whoever is coming out from a juvenile or a custodial setting, what are we ensuring to make sure that they can fit in back into the community? So that's something which we never focus on, and they always stay as a category which is just sidelined, as they don't belong back into the society, and we don't take that extra effort to make sure that we have things in place so that they can find employment, accommodation, and they can just get back to, they've already, if they've even done a crime, or even if they've been accused, they've already served their time for it, and now they're outside and we should be providing that support for it. So these are some of the issues that we discussed. If I've missed out anything, I'm sorry, Mary, Isaac, and Corey.
Cool. Beautifully done, Anoop. Thank you so much. So coming next to, I'm going to ask maybe someone from South Australia. Samuel, are you there? Or Kudzai, were you one of the South Australian team as well? Would you, Samuel or Kudzai, take that? Whoever gets the mic first. Whoever's...
Okay, I've managed to get the mic first. Okay, so in our group, the common theme which seemed to be coming up was the issue of the challenges of working with people from cowed backgrounds. Philip did raise the issue about, like the issue about confidentiality, because most cowed populations, they know each other. And if you don't respect that confidentiality, then everyone will know everyone's problems, and then it affects how they're linking with services. So we were kind of discussing about the best way to approach it, and someone did come up with a few techniques of working with, trying to respect the confidentiality, making sure that the information is safeguarded between the two, within the two people, and not everyone is party to people's intricate issues. So yeah, this issue of breaking confidentiality, the fear of that of breaking confidentiality is keeping people from cowed communities from accessing services, and it's imperative for service providers and mainstream services to be aware of this and to have systems in place to make sure that confidentiality is not breached. So that was the main issue coming up.
Right, thank you so much, Kudzai. And just looking at this last but not least group, Pahal, we got you in the room with Greg and Gerard and Amanda. Are you still there? Are you able to share some of the key topics from that conversation? Or are you driving along the motorway now? He's there. Oh, well, you're walking now. We need you to unmute, Pahal. Can't hear you. We need you to unmute.
Is it better now?
That's beautiful. I'm enjoying your going on this journey with you. As long as you don't start swimming as well, we'll be fine. So over to you.
Okay, then what we were discussing on our group was like particularly when we were talking about the migrant community, they don't have their language to tell exactly what their problem they are having, and the being in the male in the community, either the young or the old, whatever in the age group, they are not confident enough to bring their problem to the community, and they are also not having the good linking service where they can go when they are having the like the relationship dispute or problem and they are separated. Then they are not well looked after to get the legal services, and they have to pay for the legal services. And so mostly when they are the cold community, then they are also not able to tell exactly what their feelings, and they need to rely on the interpreter, and interpreter is not maintaining the confidentiality, and they start telling to the community after their appointment, things like that. We have discussed that all are the issue we are having in the cold community.
And I just thought about one other thing, Medicare.
Okay.
Like,
yeah, okay then, yeah, you can tell a little bit, yeah.
Once people qualify for Medicare, do you know what I mean? It's such a process. I mean, I had a friend from the UK come and she's been here for 10 plus years, but hasn't gained permanent residency yet. Her son broke his neck in a bike accident. And so once he was discharged from hospital, they had to pay every cent up front because Medicare didn't cover it, NDIS didn't cover it. And they've done their service to Australia by being employed and paying school fees and all the rest of it. But yeah, sorry, that one just came up in my brain.
No, that's okay. So just a quick snapshot of all the wide range of issues that you're bringing to us. There's stuff about qualifications from your country of origin, your sense of identity. When do you actually become an Australian? Language barriers, issues around stigma, confidentiality, and health literacy, and access to services that can connect you, linking services, use access to support from Medicare, stuff like this, before we even get into specific issues like diabetes and mental illness and all the rest of it. And what I'm seeing is just a whole, we talk in the world of men's health, of understanding and removing the barriers that prevent men from accessing health services. And what you've presented in front of us is, in this very short conversation, is just many layers of barrier and obstacle and challenge that the men in the communities that you represent are dealing with and have to overcome in order to just live a flourishing life and in order to access support and health services when needed. So lots to be done. I feel like I've learned more, I know more now than I did 90 minutes ago, and feel like we've only scratched the surface. I certainly feel there was more in that conversation than there is in the entirety of the National Men's Health Strategy. So thank you, because, because cold is just a bullet point. Let's be honest, it's just a bullet point in the National Men's Health Strategy, and that's not good enough. And not only is it just a bullet point, there is no clear mechanism or framework to ensure that as programs and services are rolled out, that these issues are actually addressed and considered even, let alone addressed. So there's so much more we need to do. And for today, I'm going to start to bring this conversation to a close. And so I just want to ask you, and you can either, in the chat box, or one or two people can, can jump in and share. What do we need to do next? What do we need to do? What do we need to do more of? How can we start to create, I don't know, relationships or connections or actions that help us get more effective at addressing some of these issues, learning from each other, supporting each other? Any thoughts? Welcome from anyone. Just wave a hand or jump in. Yes, so I've got Jal first, and I saw you, Anoop.
In regards to our two issues that we pointed out, I think one of the things that we kind of agreed on but disagreed on at the same time is community education. It does help, but it doesn't help at the same time. But it is also a good start. I think one of the things that we do have as organizations, and I hope everyone have the same, is training. So, like for instance, the Migrant Resource Center, we have cultural awareness training. We have Youth National Youth Settlement Framework training by Marianne. We have positive change makers training. Like we have different trainings that help wider community on how to work with young people from refugees and migrant background, or people from coal background to work with mainstream services. And I think one of the things that I identify, certainly in our training here in Tasmania and some of the training we do offer at MRC, what is missing is actually the idea of what racism is, what whiteness is, like what all those things are never looked at in great details. And I think those are some of the avenues where you can give people something to go away with. Like one of the things that where we talk about whiteness at our training is to ask people white people name 5 communities they're part of. Usually there's a big or how about why do you want to put me in a box, those kind of stuff. And this shows you how little white people understand of themselves or how they situate themselves within in the world as a social group. What they tend to do is that they say they're just human beings and that's all they are, which is a very colorblind ideology that doesn't serve you or me in a way that we, because your identity is only, you want to maintain that identity so that I don't challenge it and you keep your comfort. And that's one of the things that we do. And I think with our training, those conversations, they're very uncomfortable conversation, but those are some of the conversations where we need to start to make white people know that they're not the center of the world, and in a sense, giving them that they're social beings, they're from a particular group, and they also have things that they have in common, just like other human beings that can be observed. Like you, every white person know what it means to be a black person, for instance. If I walk into a shop, they follow me because they know a black person is supposed to be steal is a criminal. If a white woman clutches a purse, it's because I'm supposed to steal. Or, you know, when I raise my voice, I'm violent because that's the idea of what it means to be a black person. But they don't have the same thing about themselves. And I think, to put it in short, I think those trainings have to be stretched to be a little bit more uncomfortable. White people, that socialization have to be unlearned again. If we don't start from there, we are working from a colorblind structures, and that structural and systemic stuff will still be there if we don't tell white people that there's things that they do as white people that actually alienates the rest of us. Those things, because when I have a conversation about white people, about race, I don't care if they're in England, if they're in Brazil, if they're in Victoria, or wherever they're from. That conversation is the same. They're just human beings. So this shows you what it means to be socialized as a white person. And this is where I think we have to help them unpack all those things with our training, and then build on these other things. Otherwise, we'll never get anywhere.
Thank you, Joel.
That's so powerful. One of the modules we do in our group is power and privilege. So trying to get the participants to acknowledge the power that they do have. And like you said, and I mean, it's the amount of times I've had conversations around Black Lives Matter versus All Lives Matter. Like, you guys just don't get it. Like, it is so ingrained that everything you said, Joel, everything you said. Yeah, 100%.
Beautiful. So Anoop, coming to you next. Thanks, Amanda.
When we usually go and try to, say, request for a funding for any sort of project with any government body, the first thing that they want to know is about statistics or the numbers. So without seeing those numbers, they don't give you the funding. Now, if they don't give the funding, we don't have those numbers. So some way or the other, we need to, from existing projects, we have to somehow utilize some sort of money. So I think it also goes into a bigger picture of having a equity, diversity, inclusion sort of a policy in every organization, where you actually understand that you have to allocate a certain amount of money, like how you're doing the research for other things. Allocate that money for understanding the cultural issues, understand if there's supposed to be an Indian or a Pakistani or an African community. Let's find out what are the languages they speak, what are the challenges that they face, do they have enough health support, do they have the health literacy, what are we providing? So once we get those numbers, so I think where I'm going with it is every organization should at some point have an equity, diversity, inclusion policy where we can actually get the funding or the money to raise money and things for doing the research to get those numbers. Once we get those numbers, we at least are, if not, obviously we can't move 10 steps ahead, at least we've moved one step ahead in order to understanding and making everyone aware that, yes, this is part of the Australian culture. This is part of the global culture, that we have people who look different, might be from a different socioeconomic background, might be having a different sexual orientation or gender or whatever it is, but we all belong together. And if we don't allocate money for everybody, we can't keep funding the same set of things that have been happening over and over again. If we keep funding the same things, we can understand all the other issues that are there, and we can never address it. So that is what I feel is one of my take-home messages for everybody. So if everybody could go back to your organizations and And even every meeting that you head down to, ask everybody to start an equity, diversity, inclusion committee so that even their board members have that diversity inside the board, because you could have an excellent CEO, and if the board is not supportive, they're never going to hire someone, or they're not going to be supportive of any multicultural project. You could be bringing 100 projects which are really good, and they're just going to throw it out of the window. Okay, I'm not blaming any organization, but I have worked in organizations where it is that has been the case, where you're never good enough. Your 10 years of experience or your overseas qualifications never good enough. We'll wait for another 2 years or another 3 years maybe, and then we'll think about considering you. That shouldn't be the case. We need equal representation in every organization. I'll leave it at that.
Yeah.
Thanks, Marianne from FECA.
Yeah, I just want to add to something related to what Anup was saying. Aside from that policy on equity, we also in FECA, we're trying to advocate and very strongly asking everybody else to also advocate for adequate data gathering in terms of understanding who are from called background. As people would say, if it's not counted, it doesn't count. So we don't really have a good sense in terms of health, how much of a problem is specific conditions. Even with the COVID situation, what we're saying to the government is that, we are doing all these blanket translations and all these, but if there is one specific community that needs a targeted approach, we should do that. And the data should tell us where to go and how to do these things. But because we don't have a very good way of really, understanding the CALD community in terms of data gathering, we're not able to actually do a very good and very targeted programs or policy interventions. FECA, moving forward, just to share with the group, FECA will be developing its strategy on CALD health. And I think men's health would be a major part of that. And what we are looking at in terms of perspective or framework is really about life course. This is especially important for those with migrant backgrounds, because the way your migrant experience or your background before coming to Australia is very important in understanding how we could work with certain communities in dealing with their health challenges. So we would be doing a series of consultations, and I'd love to be in touch with everybody else in this group to move forward with that.
Right, that's wonderful, Marianne. Any way we can support on the men's health piece, let us know. We're very happy to be involved in any way you think's appropriate to do that. So we've hit 3:45. I'm sure there's loads more to say, but unless anyone's got a burning kind of desire to make sure something's said right now, I'm going to start to just wind the conversation down and let you
I'm just going to advocate for you sending around the contact list again, like I did yesterday, because I think there's a lot of conversations that still need to continue from here. And
totally. So thanks, Amanda. So what I'll do, because you haven't given permission to share your emails, is I'll send an email around first to all of you privately, just saying thank you, and that we're going to share the emails the next day. And if you don't want me to share your email for any reason, which is fine, I'll give you 24 hours just to come back and say, please don't share for whatever reason. And then if we don't hear back, I'll send another email around copying in everyone who attended. So thank you so much. Really appreciate you giving your time today. I know we've really only scratched the surface, but I hope it's been as valuable for you as it's been certainly for me. I hope you've made some new connections and learned some stuff from hearing other people, and also just learned some stuff from reflecting on your own kind of thoughts about the issues that we've been talking about. I've given you'll have my contact details. This is very much the beginning of a conversation.
Congratulations, you have successfully installed and executed the Asterisk open source PBX.
That's it. Oh, it's my phone. It's my phone was talking to me. How very that is a symbol that after 30 days, I need to go and actually talk to some real live human beings. That's the perfect way to end 30 days on Zoom. I think Greg wants to say something before we all say goodbye.
Yeah, look, thanks, Glenn. I just wanted to say something quickly about this session. And look, for me, it's all about food. It's all about the fact that Australia got colonised by the UK, and let's face it, sorry, Glenn, their food isn't all that great. And then the Chinese arrived here about the 1800s, and we had Chinese foods for the first time. And then we had the Italians and the Greeks, and then we had everyone come here. And Australia has the potential to be one of the greatest countries in the world because of its multicultural mix. To me, that's really important. That's what makes us Australians. I used to live in Sydney and I now live in Newcastle. Newcastle is a very white Anglo place when we arrived here. And what I miss most of all from not living in Sydney is the food, okay, and the culture and the people. I love going back to Sydney to see people from all parts of the world. That's what I miss the most, living in Newcastle. So I've taken a little food trip through our session today, but and I'm using it, I guess, as an analogy for everything else, food, culture, religions, backgrounds. This country has the potential to be an amazing mix of people, but we have problems in Australia that I'm sure you're all aware of, problems with people taking very strange views about people from other countries or people from other religions, and that's what we need to be aware of, and we need to continue to focus on inclusiveness, and AMHF is doing that. This has been a great session for me, and I think for Glenn. So thank you. Firstly, thank you all for being part of this. We will definitely be setting up a structure within AMHF for us to stay together and keep communicating and keep working on new things we can do, because we're doing two things at the AMHF is trying to make men-friendly services across this country, and then men-friendly for people from culturally, linguistically different backgrounds services, because everyone's included. So we're sort of operating on this area of everyone being included. And so that's where we're going on that. The other point I wanted to make is this is the end of Men's Health Connected, which has been running for 30 days through June, which has been an enormous exercise for AMHF. I want to congratulate Glenn, our CEO, who came up with this crazy idea on March the 13th or 14th, when we knew we couldn't have a conference in May, and he and I talked. I was in hospital at the time, and we had an interesting conversation with me online to him in the drip room in the ward I was in. It was very interesting. And the world was going into social meltdown and social closure, and we thought, why don't we do this? And I thought, this guy's crazy. We can't do this by the timeline of doing it in June. We've done it. It's been enormously successful. It's been fantastic. It's been one of the best things I would think AMHF's ever done. We've connected with more people ever, and we've done a huge amount of networking. And what will come out of this is that we've got a whole group of people who are working in the field or interested in the field, and it takes us forward to the next thing we're going to do, which isn't far away. We're in planning mode, and we're in a way that we'll move forward from this. And I wanted to thank you, firstly, people in the room at the moment, for being a part of this. It's been fantastic. Thank you for supporting us. But also a huge thank you to Glenn, who's done an amazing amount of work, you've got to admit, you know, applause for Glenn. He's been fantastic, you know. And we will meet in the morning tomorrow to debrief this, but he and I will. But thank you, Glenn. It's been great. It's been wonderful. It's moved men's health in Australia. You know, we were moving pace by pace, a few feet apart. I think we've taken a quantum leap with Men's Health Connected. We've connected with more people than we ever have before. And it's been free for everybody to access, which I think is the most amazing thing. You don't have to pay a lot of money to be part of Men's Health Connected. And we've made a lot of new friends. And we've appreciated a lot of people's great work in the area. So thank you all. Thank you, Glenn. It's been wonderful.
Back to you all. Thanks for being here today for this conversation. Please stay in touch. You have our contact. We want this to be the beginning of a conversation, not the end. So thank you.